full program on stem cell treatment in ENT with respect to ENT, not with respect to anything
Yeah.
else. But he will. You can ask any question you want, and he belongs to our place, Trichy. We are so proud that he is from our place, and we have one of the top-notch centers in stem cells treatment. And I'm so happy to introduce Dr. Ravi. He is my family friend, a very very close friend, and also a very very nice gentleman, affable person. And one important point is we were one of the founder members of Kaveri, today KMC, Kaveri Medical Center, now known as Kaveri, and we were instrumental in developing that center. So over to Dr. Ravi without much ado about stem cells. Dr. Hiba from Syria will be the moderator. Dr. Hiba is here.
Yes, sir. Yes.
So you will be the moderator of the session, and
Okay.
I am going to mute myself. And here you can unmute and just ask questions. Let it be a discussion. Okay,
Okay.
over to you, Dr. Ravi. Thank you.
Yeah. Thank you. Yeah, thank you, the Dr. Janaki Raman for the nice introduction. Thanks to the moderator, Doctor. Are you from Syria or where is your location?
Yes, I'm from Syria, sir.
Yeah, good. So nice
Thanks for
to see
being.
that.
Thank you. Thank you.
So, any previous experience about stem cell therapy in Syria for
Uh,
any indication,
no,
not only ENT, but any other?
no, actually, no. There's no stem cells in here, so
Yes.
it's really challenging when you deal with some cases like atrophic green yeast and sudden hearing loss. Yeah.
Okay.
So that's
So,
why we would like to hear more from your expertise in that.
yeah, sure. So actually, Dr. Janak Raman wanted me to talk only about stem cell therapy in ENT. So it will be one more focused on that. But before that, as I just want to give us some basic introduction, because stem cells are there in our body, even in an adult. Every tissue has got its own share of stem cells, percentage of stem cells. If there are 100 skin cells like keratinocytes and fibroblasts, then there is one stem cell which can become a keratinocyte or a fibroblast or a melanocyte. So similarly, in the front of the eye, in the limbus, you have got stem cells which can become the corneal cell, which can become the conjunctival cell, and which can become the scleral cell and repair injuries to all the three areas. One stem cell can repair injury to three particular cell types in a particular tissue. So stem cells are the basic repair toolkits found in every tissue in the body. Wherever there are, it is multicellular. All tissues are multicellular. So all the tissues contain their own share of stem cells. So some of the stem cells are good in number. For example, in skin, in the gut, in the liver, the number of stem cells are plenty. Whereas in organs like heart, in cartilage, in brain, and in the middle, in the inner ear, and in the retina, the number of cells are very less. But still, there are stem cells in all these tissues also. So as I said, whenever there is an injury, when we talk about sudden sensory neural hearing loss, that is a very, very classic example of where stem cells can help. So, suddenly, due to some unknown etiology, there is a loss of the function of the inner ear. So, whenever there is a loss of function of the inner ear cells, and any attempt at rescue by giving drugs like steroids or any other drug, anti-inflammatory and other sorts of drugs, when there is no response. So there is a possibility that some of the cases respond and some of the cases don't respond. So steroid resistant sensory neural hearing loss, sudden sensory hearing loss. Similarly, we have like in transplants, we have graft versus host disease, GVHD, where there is a failure of the graft due to immune rejection. So there also steroid is the first line of treatment. And when the steroids fail, there is no other option. So in situations where there are no options, that is where the role of stem cells come. So wherever there is either absolutely no other treatment choice, or if the available treatment choices are not adequate to completely recover and regenerate the tissue, then there is a role for stem cells. So in that way, as I said in ENT, the classic will be SSNL, so sudden sensory neural hearing loss. Similarly, all chronic diseases where there is atrophy, they are all good cases for stem cell therapy. For example, atrophic rhinitis, where there is the mucosa and the mucus secretion, the glands, the glandular part, the epithelial part, the fibrous tissue part, the extracellular matrix part, where all those things atrophy, then there is a role for stem cell therapy which can regenerate the mucosal epithelium, it can regenerate the mucosal glands, it can regenerate the fibroblasts, which are going to lay down the extracellular matrix, which is forming the bulk of the tissue. So similarly, there are indications in vocal cord wherever there is a chronic inflammation, it can, and they are resistant to the routine treatment, then there is a role for this. And paralysis. So in vocal cord paralysis, certain indications, either due to some trauma or iatrogenic, and then it has not completely recovered, then there is a role for stem cells to regenerate. So most of our treatments in allopathy, we are only giving symptomatic treatment, or we are giving substitutive treatment in chronic disease. For example, if the patient has got diabetes mellitus, if the type 1 diabetes where the beta cells are not producing insulin, we only give insulin from outside. We don't make the beta cells produce insulin again. Similarly, if dopamine is not produced by dopaminergic neurons, then we give dopa from outside. We don't make the neuron produce the dopamine again. So this is an attempt of regenerative medicine where the drugs have failed. So our entire medical system is undergoing a huge change from, as I said, symptomatic and replacement therapy to regeneration of the organ itself. So in that scenario, you can think of many of the ENT diseases where the results are suboptimal. Then we can discuss what are the possibilities. So, as you know, when you go to the net and search in the PubMed, you can see a lot of articles for stem cell therapy for sudden sensory neural hearing loss, for vocal cord paralysis, for atrophic rhinitis. So, there are a lot of publications already available. So, which of them are successful and which we can further explore. Then comes the question of what cells are good
Ravi,
in ENT.
I want to
What?
I
Yeah.
want just to bring to your notice. Yesterday I was in Dubai.
Okay.
I was seeing a patient where both the turbinates have been cut.
Oh.
Okay, a very common finding in many noses. They just cut
Oh.
off the turbinates, both the turbinates.
Oh.
He was desperate. He is a Saudi patient, an Emirati,
Oh.
and he wanted. There's no way I can do a Lattenschlager's operation. He wanted an alternative. I
Oh.
said stem cell therapy, and he has not heard of it from anybody in the world.
True.
And
True.
he
True.
was the first doctor to tell about stem cell therapy. And he also went to the PubMed, and I showed them the role of stem cells in empty nose syndrome.
Correct. Correct.
So regenerate the inferior turbinate. So you
Yes. Correct.
please carry on.
Yeah. So it is tissue engineering. So when we combine stem cells with scaffolds, then it is called tissue engineering. So where we can regenerate the turbinate. Suppose you want to regenerate the turbinate, what we have to do is we have to have a scaffold like hydroxyapatite or collagen, and then fill up that extracellular matrix with stem cells and use it as a patch over the area where you want to regenerate the turbinate. So it is possible to regenerate lost tissue. Like suppose there is a hole in the loss of cartilage, or if tympanic membrane, when you do tympanoplasty and when there is a partial success, and then you want to improve on the success, again you adding stem cells will help. So when you combine surgery with stem cells, your chances of success are more. So it is not like either surgery or stem cells. It is actually surgery with stem cells. So there is a role for stem cells alone, then there is a role for stem cells with surgery. And then the third point is what are the sources? So where are we going to take stem cells for ENT? So one of the best source is bone marrow. The next best is the fat. So when patients have got abdominal fat, we can take the stem cells, like plastic surgeons do the liposuction. So we can do the liposuction and take the stem cells from the fat. But bone marrow stem cells are little more powerful, and they act immediately because they contain other growth factors also. But we can also take stem cells from many other tissues like hair follicles. We can take 20 or 30 hair follicles from the back of your head, and then from those hair follicles we can extract the stem cells and use it for patients in different tissues. You take from the hair follicle, then you can use it for vitiligo, so because hair follicle contains a lot of melanocytes. So when you take stem cells from any tissue, it can be used in another tissue. So that is one of the reasons, like when we take from fat and bone marrow, we can use it in ENT, we can use it in orthopedics for regeneration of cartilage, we can use it in infertility. Lots of doctors in male and female infertility are using stem cells taken from either the bone marrow or the fat to regenerate endometrium, to regenerate the ovary, to regenerate the testis for infertility due to oligospermia, azoospermia, and also for erectile dysfunction where the cavernous tissue has gone for degeneration and we can regenerate. So you can take the stem cells from one tissue and use it in another tissue. So for ENT, which is the best source? So the best source will be from the bone marrow, which will be very effective. Second best will be from the abdominal fat, and third will be again from the either the skin or the hair follicle, and these are all autologous. So most of the times, 99% of the time, we take the stem cells from the same patient. But rarely, when the patient is very old, like if he is, say, 85 years old, his own stem cells are less in number. Then I'll just show this thing in just behind me. You can see this is actually the stem 1 for osteoarthritis. So here you can see that there is a bottle. So this stem 1, which I am showing here, is a bottle
Yes.
which contains stem cells from another patient. So this is a allogenic stem cell which is approved in India. So it is called as stem 1, and it is from the company called Alchem. So Alchem is the distributor, and the stem cells are taken from another person. From 3 persons they take, and then they make it into 3,000 doses, and this stem 1 is for osteoarthritis. Similarly, this is Regenasip. This Regenasip is for diabetic ulcers. So for diabetic ulcer patients, whenever there is an ulcer which is failing to heal and the patient has to undergo amputation because it is not healing, then we have got a cell called Regenasip. So these two stem cells are approved in India. So you have to be aware that stem cell therapy is already approved in several countries, and India is one of the countries where maximum number of therapies are approved. As I showed you now, for osteoarthritis, it is approved since 2022. For critical limb ischemia, where there is an ulcer not healing and patient is going for amputation due to diabetes. That regenerative is approved, it is available, and similarly for TAO, that is smoker's disease, thromboangiitis obliterans, what is also called as Burgess disease, the stem cells are approved. Similarly, for hair regeneration, for under eye dark circles, and skin regeneration. So these are 7 indications for which stem cell therapies are already approved in India, and the patients have got two choices. One is they can choose their own stem cells. Like I said, we can take from their own bone marrow or from their own fat or from their own hair follicle, different. And the second is allogenic. Allogenic means taken from somebody else. So the allogenic can be either bone marrow or fat.
उस पर डिपेंड करता है भाई
So it is taken.
क्या कही मैं एक पेन बताता रहता हूँ
Yeah. Am I audible now? Yeah. So it can also be taken from another person.
Yes,
And
yes.
yeah. So umbilical cord, the people are storing umbilical cord stem cells. So it can be taken from the umbilical cord blood or the umbilical cord tissue. It is not approved in India. In India, it is only the bone marrow stem cells taken from another person that is approved. USA also has only approved bone marrow stem cells for a condition called GVHD, graft versus host disease, when there is a transplant and post-transplant there is a graft rejection. Then these bone marrow stem cells taken from another person, allogenic source, is approved in USA since last December. So similarly, Korea and Japan, fat-derived stem cells are approved. So as I said, for stem cell therapy, we can take the cells from different sources. Either it can be autologous. Most of the times it is autologous because our own stem cells are good enough up to the age of 75. Up to the age of 75 years, we can take stem cells from our own body. And only in very, very old people and very frail people, where beyond 80 and 85, when they need the treatment, they will have to we can take the stem cells which are readily available in some of the countries. So this is about the availability of stem cells and what are all approved. And I think regarding the ENT applications, we have just starting. So many centers in India are just thinking about it. While people are thinking, Dr. Janagiram has already started. So because we are already being working together for so many years, we have a lab where we grow the stem cells. So when we take in Royal Pearl Hospital, when patients come with sudden sensory neural hearing loss, what we do is we give some sedation and local anesthesia to the patient and take his stem cells from the iliac crest bone marrow. So I go to the OT, I take the stem cells, and then within 1 hour, we can separate the stem cells in our lab. So we have a lab where we can separate the red blood cells, white blood cells, plasma, and all those things which are not useful for regeneration. They are all removed, and only the stem cells are collected and concentrated. And then that is injected into the middle ear cavity, like how we inject steroids for cases of sudden sensory neural hearing loss, or for tinnitus, or for severe vertigo. So some of those cases, like some of the drugs which you inject into the middle ear, and how from the middle ear those drugs pass through the oval window into the inner ear, all those pharmacodynamics are already being done and established. So the same way, these stem cells are also injected into the middle ear, and from the middle ear, the growth factors, they pass through the tympanic into the through the round window into the middle ear, and the growth factors which are released by the stem cells. The stem cells release growth factors like vascular endothelial growth factor, nerve growth factor, the fibroblast growth factor, epidermal growth factor. So there are a lot of these insulin-like growth factors. So there are a lot of growth factors which are released by the stem cells, and only those growth factors help in regenerating the affected cells. So these growth factors cross the oval window and they go to into the inner ear and help in the regeneration of the secondary hair cells. So there are always, I am not an ENT specialist, but from what little I have learned in my younger days, in my UG days, we know there are hair cells and then secondary hair cells. So there in lower animals, whenever there is a loss of the main hair cells, the secondary hair cells have got the capacity to regenerate. But in humans, that capacity is very limited. But still, it is possible, and the growth factors which we inject help in the regeneration by exactly doing the same way. So similarly, as I said, other indications in atrophic rhinitis, it's a very good indication because we have done for atrophy of the mouth, oral cavity. People take pan parag, no, they chew tobacco and then they develop oral submucous fibrosis. So this pathology is being treated by dental surgeon, but the patients also come to ENT surgeons because they have got a dry mouth, they are not able to open the mouth, and then they are not able to eat. So, and in those situations, we have taken the stem cells and injected into the both cheek intraorally as well as to the floor of the mouth. Thereby, we have increased not only the mouth opening, but we also regenerated the accessory salivary glands. So the accessory salivary glands, which are there in the oropharynx, they have been regenerated and the patient is able to produce enough saliva. So before treatment, before stem cell therapy, he is not able to open the mouth, and even a small amount of food he has to chew. He cannot chew and then he will take a sip of water. Every spoon, he will take a sip of water. Again, another spoon, another sip of water. But after this stem cell therapy, he is able to not only open the mouth, he is able to complete his meal and then only he is taking the food. So these are all some of the mechanism how the stem cell therapy works and how we can regenerate tissues. So atrophic areas can be regenerated, chronic inflamed areas can be regenerated. For example, in orthopedics, we have regenerated these shoulder tendons, the ligaments, and the meniscus inside the knee joint. So all these things we have regenerated using platelet-rich plasma and stem cells. And similarly, the vocal cord, that's also the cartilaginous tissue. So wherever there is a cartilaginous tissue, it can help in healing. Similarly, tracheostomy wounds, when the healing is not, most of the times it heals well, but if the healing is not good, if the scarring is more, if you want to reduce the scarring, then when you combine it with stem cells, the healing is much better and the scarring is much less. So as I said, finally, my conclusion is that stem cell therapy is a very good new therapeutic option in every field of medicine, and ENT is no exception. ENT has also got several indications. In ophthalmology, they have cured blindness from 0% vision. A person who is having a corneal ulcer, corneal sclerosis due to acid injury, alkali injury, if one eye is affected, they will take stem cells from the unaffected eye, limbal stem cells, and place it in the cornea. And from 0%, they get back 30 to 40% vision within 3 to 4 months. Similarly, now they have started using stem cells for retina. So, like every organ, which were all not treatable previously, only for corneal blindness, you have to do cornea transplant. Similarly, there was no treatment for retinal degeneration. But today, there is stem cell therapy which can treat conditions which were not treatable before. So, new generation doctors. So, whenever I say, I end the lecture like this. So, if you are a young doctor you should know about stem cell. Who should know about stem cell therapy? If you are a young doctor, you should know, because many of your patients in the future will need stem cell therapy. If you are an old doctor, you will need it for yourself and for your family members, because many of the old age diseases like osteoarthritis and then chronic ulcers, we have treated with stem cells and we have prevented amputation and joint replacement. So similarly, we can postpone kidney transplant, we can postpone liver transplant, and regeneration of the organs are also possible in the future, one by one. So as I said, 7 diseases are already approved in India since 2017. Every year there is 1 or 2 diseases which get added up. So similarly, all the diseases like liver disease, renal disease, can also in the future, cardiac diseases will be treated with stem cells. So with that, I conclude, and I think few questions we can take up.
Okay, thank you so much for this demonstration, sir. I want to ask you a question myself.
Yeah.
In atrophic renates, actually, where do we inject? At what layer? Epithelium or like submucosal? And there's another thing too. In most of the atrophic renates, actually, sometimes we could see like inflammation or we can see infections out there. We need like to recure the situation and then inject, or it can be sometimes so chronic, so difficult to do that. So how could we manage all that technically?
Yeah. So most of the times it is injected locally. So for as I said, no, in submucous fibrosis, we injected under the mucosa. So similarly, in the floor of the mouth also we injected, and for the ENT, as I said, no, for for the inner ear, like how you are injecting the drug. Suppose the pathology is in the inner ear, but still you are injecting steroids in the middle ear. So how does this work? How does the steroid act on the inner ear? So all this pharmacodynamics, no. So they have already been done. So for the sake of the drug, all this has been done. So it is the same mechanism. So most of the times they are injected locally at the tissue.
Submucosa.
Yes, submucous, correct. Multiple,
Submucosa.
4 or 5
And when you,
locations in this. Yeah.
yes,
Good morning.
Yes. Good morning, doctor.
Good morning, Dr. Ravi, Dr. Hiba, and
Yeah.
good morning, boss, everyone. I have 2 questions, not in the ENT using,
Yeah.
but about patient with DM before or after insulin and kidney function disease before or after dialysis.
Yeah. So in the researchers are going on in India. There is one Dr. Anil Bansali from PGI Chandigarh. So from 2012, he has been researching on stem cell for diabetes mellitus. So he has taken patients' own stem cells and injected into the artery. So superior pancreatico-duodenal artery. So from the femoral artery, like catheterize and then go up to the superior pancreatico-duodenal and inject it into the artery. He has also injected into the vein and compared them. So you can Google his name, Dr. Anil Bansali, Chandigarh, stem cell for diabetes. So similarly, for renal diseases, there is one BJ Medical College in Ahmedabad, where they had done extensive work on stem cell therapy for renal diseases. And in their cases, they have done along with the transplant. When they take the kidney from the donor, they take the donor's stem cells also, and then when they do the conditioning for the patient, after the conditioning is done and transplant is done, they inject the donor's stem cells also. Apart from the donor's kidney, they inject the donor's stem cells also, and they have done extensive studies. And you can Google the name H.L. Trivedi. H.L. Trivedi. He was the pioneer for stem cell therapy in renal diseases. So some of those researches are being continued. Some of them have not been continued after those persons retired. But all this work has been going on in our own state of Tamil Nadu, in Stanley Medical College. They have got a stem cell lab for liver diseases. So they have done animal studies, and we have also done an animal study with medical college in UAE, where we have shown that the exosomes taken from stem cells have helped in curing the liver disease in rat. So we have done the animal studies, created the chronic liver injury in the rat, and then used our stem cells to produce the conditioned medium which has cured the pathology. So many animal studies are going on, many human studies are going on, and some of them have been accepted by the governments, and treatments are available. Others will soon come, like how you are asking for the kidney disease and heart disease and other diseases. They will soon be approved one after the other. But already phase 2, phase 3 trials are going on.
Thank you.
So if the patient has cirrhosis, it wouldn't affect the healing?
If the patient has, excuse me?
Had cirrhosis or
No, I don't get it. If the patient
have,
has
if the patient has cirrhosis or any chronic
cirrhosis,
like
yes,
renal
yes,
disease or
yes,
yeah,
cirrhosis, yes. They are. They have already done. There are human clinical trials. They have shown that the cirrhosis of liver can be reversed, can be regenerated. So animal studies have already been done, numerous studies, and human clinical studies are also on the. They are being done phase 1, phase 2 in multiple centers. In India itself, there have been few centers where they are doing it.
Hello.
Yes.
Thank you, Doctor, for this nice lecture.
Thank
This
you.
is Dr. Ahmed from Oman. May I ask you
Yeah.
one question, please?
Yeah.
Suppose in nasal cavities like atrophic rhinitis, we took a bone marrow and we injected directly submucosally. What will happen? It will work or need to filter that and take only the stem cell?
Yes,
So,
you have to
yeah.
concentrate. Yeah. So you take from the bone marrow, and then we have a process of there is a method called FICOL. You can search in the Google FICOLL, FICOLL, FICOL method. So that's a density gradient substance which will help in separating the stem cells alone. You don't want RBCs, you don't want the other cells. Differentiated cells are not going to help in regeneration. So if you remove all those cells which are not helping in regeneration and only concentrate the cells which are going to help in regeneration, then your results will be much better. Otherwise, those RBCs, they will die. If we inject with the RBCs will die and they will create a nidus for infection. So it is better to remove all those cells which are not going to help you, and then only inject the cells which are going to survive and help you. So that is a process, and that takes hardly half an hour to 45 minutes. You need a lab.
So yes, so they were asking about the cost of therapy.
So in India, it's roughly around 1 lakh rupees. For say, I am an orthopedic surgeon, so I am doing it for osteoarthritis, knee joints. So for both knee joints, it costs around 1 lakh if it is autologous, if we take from the patient's own body. So this, if it is allogenic, this stem cell which I showed, no. So this allogenic is costing 1.25 lakhs. That is
And dollars,
readily available. Only thing we have to, if we order, it will take 2 days, 3 days for them to ship it with a ice box. So they will send it in a liquid nitrogen tank from Manipal. That's the place where it is being manufactured, and from there it is supplied throughout India. So whether it is cost
if we
dependent
could
on
say in dollars.
autologous or allogenic.
No, if we could say in dollars, just for the sake of everyone to know.
Yeah. So
Hello,
we can.
Not in.
Excuse me.
Like how much it costs, like in dollar, not in Indian.
From the donor. So you want the cost or what?
Dollar. No, sir. Dollar or euro or
Dollar,
just like
dollar. Yeah. So I think $1 is 80 rupees roughly. So roughly it is 80 rupees. So when it is 1 lakh, so it is like 1,200.
$1,000. Okay.
Yeah.
Very good.
$1,200.
Dr. Ravi, sir, good morning.
Yeah, good morning.
Dr. Amit Patidar from Indore. We have discussed.
Yes, doctor. Yeah, how are you?
Yeah, I'm fine, sir.
Yeah,
How are you,
thank
sir?
you. Yeah, fine, fine, doctor.
I'm just asking one question. Is
Yeah.
this SVF is better than bone marrow or what? What the
So
main?
yes, yes. So bone marrow has got more growth factors because it contains the hematopoietic stem cells, endothelial progenitor cells. These are all available in the bone marrow in much more numbers, whereas the MSC, the mesenchymal stem cells, are more in the fat. So when we compare for immediate effect, bone marrow has got very good role. But when we want to culture, I think fat is a better source because even while we take, we have a lot of MSCs in the fat more than in the bone marrow. So that depends upon whether you're going to do immediately or we are going to do culture.
So for sudden hearing loss, as Dr. Narayan Jankiram sir is using right now,
Yeah, yeah,
so
yeah.
more
That's bone
better.
marrow. That is bone
Bo-
marrow. Yes,
So,
yes.
so is there any complication we have to explain to patients about the bone marrow extraction and all things?
No, actually, any orthopedic surgeon in your place, they are regular. We are regularly doing this aspiration. So you can take the help of a orthopedic surgeon to extract the bone marrow, and then for injecting, it is only ENT surgeon is doing it. It is like any intratympanic injection which you regularly do, like steroid injections. So
Yes,
that
sir.
that pain, whatever it is, the pain, all those things, nothing extra.
So I'd use 3 to 4 patients of this SVF, sir. Actually,
Uh,
I'm doing Sahaj
Good, good,
Hospital.
good, good. As I told you, there are multiple sources. So we want to do a comparison. Suppose you are doing fat and your friend is doing bone marrow, another friend is doing umbilical cord. Then we can do a comparison and then see which is the best. Because you cannot inject more than 1 ml. No, maximum is only 1 ml you can inject. So you want to get the best source. So I think we can combine to do a study. So we will do each, we will do say 25 cases, and then we can combine and see which gives best results. We will do a good selection criteria where we will keep almost the same age group and similar hearing loss of similar duration, so that the comparison will be much more meaningful.
Sure, sir.
Yeah.
So there's another question actually. In which way
Yes.
intratympanic injection useful or action of stem cells in the middle ear? Any article of that?
For middle ear pathologies.
Yeah, they're asking about the intratympanic injection. Like, where do we inject it? Like the technique of injection
No, I think that
in
Dr.
tympanic.
Janakiraman will be the best person and he will even demonstrate. So, in one of the cases, he will be able to demonstrate to you how he is doing it.
Okay. I asked you before, sir, about the if we had like an infectious field in our way, like before we have stem cells, do we have like to cure it before, or we just like inject right away?
Infections.
Infections, especially in atrophic ring yeast. I had a patient myself. Actually, they forget a bag in there, and she had like a atrophic ring yeast for
Uh-huh.
like 3 years
Uh-huh.
before,
Uh-huh.
and she had like a chronic infection, no
Yes.
curable at all,
So,
and
actually,
like developed to atrophic ring yeast.
yes. So, in
So in
diabetic
such
ulcers, yes.
complicated cases, how
Yes,
we
yes.
manage.
So in diabetic ulcers, we have seen such a severe infections. So the most of the diabetic ulcers are infected. So we do debridement and then we give antibiotics. But still, the infection is not completely gone because it is open. It's an open wound. So the major advantage of stem cells is that the stem cells also the stem cells and the associated platelet growth factors, they have antimicrobial peptides in them. So when we take it from the bone marrow, it also contains some of the platelets, and the growth factors inside the platelets have some of the antibacterial peptides. So even without an antibiotic, we have shown what are all the organisms which it can kill even without a antibiotic. So in even infected situations, these are better because they by themselves have a anti-infective property. So you need not be afraid when you are injecting into an infected area. If you are not able to eliminate the infection completely, you need not worry, because this itself has got a very good role on as an anti-infective agent. So it has been proved. So you can go to the articles and then find out the about the role of the growth factors in the platelets and other cells which have anti-infective properties.
Yes, sir. Yes, sir. Thank you.
Okay.
Excuse me, one more questions about
Yeah.
common case in ENT. It is septal perforation.
Okay.
Septal, yes,
Which
septal perforation. How we can use stem cells in septal perforation?
septal perforation. Okay.
Yes.
Yes, so that will need tissue engineering. So whenever there is a defect, then it is not only injecting the stem cells. You have to use something like a collagen sheet and or a tricalcium phosphate, and then incorporate the stem cells into that, and that has to be used like a patch. So like how they do for hernia, they have the patch. So similarly, for a defect in the palate, so when they do surgery, there again they have to use a patch with the stem cells. So spina bifida. So there is a condition where even within the uterus they are doing the surgery where they use a patch to close the spina bifida using a patch and the stem cells. So wherever there is a defect like a septal defect or hole where you want to regenerate the tissue, then you will not only need stem cells, you will need the scaffold also.
So we have like to put a graft and then use the stem cells.
Exactly. Yeah, and we can make that in the lab. So we will try to show some of our cases which we will be doing in Royal Pearl Hospital soon. So how we make these tissue engineering. So we are going to have a conference in on 28th. I will just send the details, so people can attend online also. So there is a talk. It is about burns. So where in burns we are going to do tissue engineering of skin. So similarly, tissue engineering of cartilage. So tissue engineering of mucosa, tissue engineering of so many other tissues. It is the same principles. So soon we will learn all those things. Okay.
Okay.
Okay, doctor. Thank you so much for giving this opportunity. And again, we will interact as we do more cases. We will interact and show you how we are doing it, like this tissue engineering.
Sir, just a final question, if I
Yeah.
may. Uh, uh, for the graft, for the stem cells that have been taken from another patient, is there any incidence of rejection or allergy?
So mesenchymal stem cells don't carry the HLA surface antigen. So mesenchymal stem cells can be given from one patient to another patient without matching. Whereas the other types of cells has to be hematopoietic stem cells. You cannot give from one person to another person without matching. So whenever we say cultured cells taken from another person like this, it is actually it is cultured mesenchymal stem cells alone. So because in the body there are three cell types which don't require matching. One is mesenchymal stem cell. Number two is platelets. Platelets do not need matching because they don't carry the surface antigen. Similarly, natural killer cells, NK cells. So these three cell types in the body can be given from one person to another person without matching. So there is no rejection.
Mhm. Yes, thank you, sir. If
Thank
there's any question from the audience, please you could ask yourself.
Yeah. So thank you. I think we have already exceeded the time. And I thank Dr. Janakiram for giving
Yes.
this opportunity. As I said, we will interact more and whatever we do new, we will come out and show you how it is being done, so that you can carry out in your own place, and we will help you, assist you in making a lab, how to make a lab. So all those things we will show you subsequent. Thank you.
Thank you for your precious time, sir. Thank you.